Avian pox. Definition and general overview of the disease in birds. Avian pox, also known as bird pox or pigeon pox, is a viral disease that affects various bird species, including pigeons. It is characterized by the formation of raised, wart-like growths on the skin, mucous membranes, and respiratory tract. Avian pox is caused by the Avipoxvirus, a genus within the Poxviridae family. This disease is highly contagious and can spread rapidly within bird populations. Avian pox is primarily transmitted through direct contact with infected birds or through mechanical vectors such as mosquitoes. The virus can also be transmitted indirectly through contaminated surfaces and fomites. Mosquitoes play a significant role in spreading avian pox, as they can become infected by feeding on infected birds and subsequently transmit the virus to susceptible individuals. Clinical signs of avian pox vary depending on the species and strain of the virus, but common symptoms include skin lesions, nodules, and scabs on the unfeathered areas of the body. Birds may also experience respiratory distress, eye infections, and decreased appetite. The severity of the disease can range from mild to severe, with potential complications such as secondary bacterial infections. Diagnosing avian pox involves a combination of clinical examination and laboratory tests. Veterinarians may observe the characteristic lesions and collect samples for histopathology or molecular techniques to confirm the presence of the virus. Differential diagnosis is essential to distinguish avian pox from other avian diseases with similar clinical signs, such as avian pox-like dermatitis or avian influenza. Preventing and controlling avian pox requires implementing biosecurity measures to limit disease introduction and spread. Vaccination programs can be effective in reducing the incidence of avian pox in bird populations. Additionally, vector control measures, such as mosquito management and environmental hygiene, are crucial in minimizing the transmission risk. In cases where birds are infected with avian pox, supportive care and proper wound management are necessary for their well-being. Infected birds should be isolated to prevent disease spread to healthy individuals. It is important to monitor the affected birds closely and seek veterinary assistance for appropriate treatment and secondary infection prevention. Continued research on avian pox is essential to improve our understanding of the disease, develop more effective prevention and control strategies, and explore potential vaccine options. Collaborative efforts between bird owners, veterinarians, and researchers are crucial in mitigating the impact of avian pox on bird populations. In conclusion, avian pox is a significant viral disease affecting various bird species, including pigeons. Understanding the definition, transmission routes, clinical manifestations, diagnosis, prevention, and management strategies of avian pox is essential for bird owners and veterinarians to effectively control and prevent the disease in avian populations. By implementing appropriate measures, we can safeguard the health and well-being of birds and minimize the impact of avian pox. Causes and transmission routes of avian pox. Avian pox, a viral disease affecting birds, has specific causes and various modes of transmission. Understanding the factors contributing to the disease's occurrence and how it spreads is crucial for effective prevention and control strategies. Here, we will discuss the causes and transmission routes of avian pox. Causes of avian pox. Avian pox is primarily caused by the Avipoxvirus, which belongs to the Poxviridae family. The virus has different strains and can affect a wide range of bird species, including domestic poultry, wild birds, and pet birds. Avipoxvirus is highly contagious, and infection occurs when susceptible birds come into contact with the virus. Transmission routes of avian pox. Direct contact. Avian pox can be transmitted through direct contact between infected and susceptible birds. This can happen when birds interact closely, such as during mating, fighting, or through social behaviors. The virus can be present in the skin lesions, scabs, or respiratory secretions of infected birds. Mosquitoes and other arthropod vectors. Mosquitoes play a significant role in the transmission of avian pox. They can become infected by feeding on infected birds and subsequently transmit the virus to healthy birds during subsequent blood meals. Other arthropods, such as mites and ticks, may also serve as potential vectors for avian pox transmission. Indirect transmission. Avian pox can be indirectly transmitted through contaminated surfaces and fomites. For example, the virus can persist on bird feeders, perches, or other shared equipment. When susceptible birds come into contact with these contaminated surfaces, they can become infected. Mechanical transmission. In some cases, avian pox can be mechanically transmitted by humans or other animals. If a person or animal touches an infected bird or its lesions and then comes into contact with susceptible birds, they can inadvertently transfer the virus. Prevention and control measures. To prevent and control the spread of avian pox, several measures can be implemented. Biosecurity practices. Implementing strict biosecurity measures is crucial. This includes maintaining clean and hygienic bird housing areas, minimizing contact between infected and susceptible birds, and regularly disinfecting equipment and facilities. Vector control. Controlling mosquito populations is important to reduce the transmission of avian pox. This can be achieved through measures such as eliminating stagnant water sources, using mosquito repellents, and employing physical barriers like mosquito nets. Vaccination programs. Vaccination can be an effective tool in preventing avian pox. Vaccines specific to avian pox are available and should be administered according to recommended schedules and guidelines. Early detection and prompt treatment. Regular monitoring of bird populations for signs of avian pox is essential. If infected birds are identified, they should be isolated immediately to prevent further spread. Providing supportive care and appropriate treatment for infected birds can help alleviate symptoms and reduce secondary infections. By understanding the causes and transmission routes of avian pox, bird owners, veterinarians, and wildlife managers can take proactive steps to prevent and control the disease. Implementing biosecurity measures, practicing vector control, utilizing vaccination programs, and ensuring early detection and treatment are key components of an effective avian pox prevention and control strategy. Vaccination, protection against avian pox in birds. Vaccination plays a crucial role in preventing and controlling avian pox, a viral disease that affects various bird species. By administering vaccines, bird owners, poultry producers, and wildlife managers can provide essential protection and reduce the incidence of avian pox. Let's explore the topic of vaccination against avian pox in birds. Importance of vaccination. Avian pox vaccines are designed to stimulate the bird's immune system, enabling it to recognize and fight against the avipoxvirus, the causative agent of avian pox. Vaccination is particularly important in areas where the disease is prevalent or has a history of occurrence. By vaccinating susceptible birds, individuals and flocks can develop immunity and reduce the severity and spread of the disease. Types of avian pox vaccines. There are different types of vaccines available for avian pox, including live attenuated vaccines and recombinant vaccines. Live attenuated vaccines contain weakened strains of the virus that stimulate an immune response without causing severe disease. Recombinant vaccines are developed using genetic engineering techniques, where specific viral proteins are produced to induce immunity. Vaccine administration. Avian pox vaccines are typically administered through subcutaneous or intramuscular injection. The vaccination schedule and dosage may vary depending on the vaccine type, bird species, and age. It is essential to follow the manufacturer's instructions and consult with a veterinarian regarding the appropriate vaccine and administration method. Timing of vaccination. The timing of vaccination against avian pox is critical. Vaccination should be conducted when birds are in good health and free from any ongoing stressors or diseases. For poultry, vaccination can be carried out during the chick's early stages or as a part of the pullet or layer management program. In wild bird populations, targeted vaccination efforts can be implemented during specific seasons or when birds are most susceptible to infection. Vaccine efficacy and duration of immunity. Avian pox vaccines have shown to be effective in reducing the severity and clinical signs of the disease. However, it is important to note that vaccines may not provide 100% protection against all strains of the avipoxvirus. The duration of immunity can vary depending on the vaccine type and individual bird's immune response. Regular booster vaccinations may be required to maintain long-term protection. Integration with other control measures. Vaccination should be integrated with other control measures to effectively manage avian pox. This includes implementing biosecurity practices, such as maintaining clean and hygienic bird housing areas, minimizing contact with infected birds, and controlling mosquito populations. A holistic approach that combines vaccination, vector control, and biosecurity measures provides the best defense against avian pox. Monitoring and surveillance. Regular monitoring and surveillance are essential to evaluate the effectiveness of vaccination programs and detect any potential outbreaks. By monitoring vaccinated bird populations and conducting periodic health assessments, early detection of avian pox cases can occur, enabling prompt intervention and appropriate management strategies. Vaccination against avian pox is an important tool in protecting birds from this viral disease. By following recommended vaccination protocols, integrating it with other control measures, and maintaining good management practices, bird owners and wildlife managers can significantly reduce the impact of avian pox and promote the overall health and welfare of bird populations.